existent. Stockpiles of manual registration books dating back to time immemorial had existed for several years, making retrieving and processing of vital data a challenge. This is now set to change.
The systems all along had been ledger manual processed, and then we have challenges along the line. This includes data collation is one, archiving the data is two, retrieving the data from the database is also a problem. So if the people should get lost of their certificates, they find it difficult to retrieve the certificates. And also those registered in the provinces, you cannot have their data at the central level. So that has been a challenge.
The Ministry of Health, with support from the World Bank, in its strive to digitize the civil registration and vital statistics in the country, is set to embark on a mass birth registration campaign across the country.
National Health Insurance Scheme is a scheme that is going to be rolled out by government to ensure that families, communities have access to health service at a cost that they can be able to afford. And then the insurance scheme also will also be there to ensure that people also are able to, to ensure that they don't incur cost on healthcare service delivery. For example, if they are to seek for services, the cost should be at a cost where they can be able to afford.
Congratulations to the Ministry of Health for embarking on a journey to make civil registration and vital statistics and health information system fully digital in the Gambia. An electronic CRVS system has multiple benefits for individuals and the society as a whole. It is the foundation for e-government and would allow several sectors to provide public health essential public health services which are effective and efficient. The birth certificate with the national identification number assigned to it would facilitate enrollment into the National Health Insurance Scheme. Can you imagine the additional resources that would have been required if the government had decided to undertake a standalone registration into the National Health Insurance Scheme?
We should all take part, we should all participate. I think it's good for every individual. You should not be left over. You should be within, as far as I'm concerned. As we start, make sure you will be the first person and jump in the boat, because it's very important. If you miss this, you will struggle to maintain your health bills, and the government is doing everything to help everyone. So the entire population of the Gambia should know that this is very important and it's good for the country and good for the people of the Gambia.
During this campaign, every individual born in the Gambia or by Gambian parents is eligible to register by simply providing any of the following documents: birth certificate, national ID card or passport, driver's license, voter's card, residence permit, death certificate of parent or infant welfare card, Alcalo attestation. Applicant without required national documents is required to provide attestation from Alcalo or district chief of the community he or she was born, together with one or both of the parents' supporting documents.
We're going to deploy teams in strategic locations, and then so that people in that particular locality will be able to have access to the teams. And the teams are going to be there for a period until they are able to complete that area, and then they'll be moved to another area. So this is what we're going to do. We don't want anyone to miss the opportunity, and that's why we are moving our intervention to the doorstep of the people, and so that when it is available to their side, they can be able to have access to it. So they should not worry about distance.
Running side by side during the electronic civil registration and vital statistics campaign is the registration of the National Health Insurance Scheme. The National Health Insurance Scheme is part of government's commitment towards universal health coverage and shall enable government to provide affordable health services to residents of the Gambia with cost exemptions on others as identified by the NHIS Act 2021. Registration for the National Health Insurance Scheme is free and will be conducted across the country at designated registration centers used during the voter registration exercise. Even if you don't have the required national documents and are a resident of the Gambia, you should go to the designated registration centers used during the voter registration exercise. The procedures at the registration center are as follows. You must be physically present, that is, appear in person at the registration center. Underage 0 to 18 years are to be under the company of a caregiver. At the registration center, all are required to follow the queue except the elderly, pregnant and lactating mothers, the sick and differently able. Hand over all required documents to the registration officials for processing and registration. A birth certificate and a national health insurance card will be issued after the completion of the process. The National Health Insurance Card will enable you to enroll as a member of the scheme. If you need additional information on where to enroll as a member of the scheme, call the Ministry of Health toll-free number 1025 or visit the Ministry of Health Facebook page.
When a person goes to a registration center, his or her biographic information such as name, sex, date of birth, and so on is recorded electronically, along with having his or her photograph taken. This information is checked immediately on site by a registrar, and the person receives a birth certificate printed on a security paper with a watermark of the Gambia coat of arms. The birth certificate has a national identification number and a QR code printed on it. These features will make it hard to forge. While at the registration center, he or she would also receive a national health insurance card which has the national identification number, QR code, and photo. Again, these features will be difficult to duplicate.
We should actually come out in big numbers and queue and patiently wait for us to be called to go and then get our enrollment cards done. This is an opportunity for you to get yourself out of spending, direct spending on healthcare.
This campaign is for women. We are the one who is bearing children, and we are the one who used to take our kids to the hospitals, and the healthcare system is our duty because even our husband, we take care of them. So I'm urging all of them to come out with full force with their family, encourage their family. Anything what women lead, it's going to be successful. So everybody should come out and register on this thing, this certificate, so that we can be a holder of a certificate and also the change of your new birth certificate.
Don't be left out. Register for the electronic birth certificate now to become a member of the National Health Insurance Scheme.
Supported by the World Bank, this important campaign is envisaged to change and improve healthcare services in the Gambia, thus advance the socio-economic lives of all residents of the Gambia. This campaign is supported by the Government of the Gambia and partners.